Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Today, we'll learn what's important to know about autologous stem cell transplants. That's when healthy stem cells are collected from a patient, frozen, and later returned to the patient after high-dose chemotherapy or radiation. My guest is Dinu, a nurse practitioner specializing in oncology at the Upstate Cancer Center. Welcome to The Informed Patient, Ms. Dinu.
Thank you.
Let's start with a very basic question. What are stem cells?
Stem cells are master cells that can generate specialized cells the body needs for growth, maintenance, and repair. They act as the body's repair and replacement system.
So we all have stem cells, and it sounds like we have them our entire lifetime?
Yes.
So when might a person be recommended for an autologous stem cell transplant?
Autologous stem cell transplants are done for multiple myeloma, lymphoma, and there's two different types of lymphoma: diffuse large B-cell lymphoma and primary CNS lymphoma, testicular germ cell tumors, and yolk sac tumors.
So are we talking about all different types of cancers?
Yes, those are the types of cancers that the stem cell transplants are done for.
And autologous means it comes from the patient as opposed to a donor.
Correct.
Do autologous stem cell transplants work better than stem cell transplants from donors?
They're not necessarily better, they're different because the autologous stem cell transplants use the patient's own stem cells to rescue the bone marrow following intensive chemotherapy, whereas allogeneic stem cell transplants, those are done from someone else's stem cells, such as a sibling, a relative, a volunteer donor, or umbilical cord blood. And those are a little bit more complicated because after the transplant, they can have a few more complications because it's someone else's cells in their body.
I see. Now, is this a procedure just for adults, or would children ever need this procedure?
It can be used in both adults and children.
What sorts of concerns do you hear from patients typically?
Would my body reject my own stem cells? How long will I be in the hospital? Will my blood counts recover? Will I need blood and platelet transfusions? Will I have to be on medications or get treatments after the transplant?
So it sounds like there's a lot of questions if this is recommended. It seems like this is a pretty big deal.
Yes.
Can you walk us through how things go? Is this usually an urgent sort of situation?
It's not usually urgent, it's more planned. So I'll talk about the stages of transplant. There's pre-transplant evaluation. That's where they see how well a person is functioning and whether they're likely to tolerate chemotherapy. They would get blood work checked. They would have their heart evaluated with an echocardiogram, their lungs evaluated with pulmonary function tests, and evaluate the kidneys by looking at blood work. Then the next step would be stem cell mobilization. Then they would go to stem cell collection. Then they would get conditioning chemotherapy, then stem cell reinfusion. Then engraftment is where the infused stem cells go to the bone marrow and produce new blood cells, and then recovery.
Let me back you up because I have a lot of questions. Stem cell mobilization, what's involved with that? How do you mobilize stem cells?
Normally, stem cells are not in your peripheral blood, and stem cells are known as CD34 cells. So the patients would get an injection called GCSF, which is granulocyte colony stimulating factor, to help stimulate stem cell production. This is usually given for 4 to 5 days, and the CD34 counts are measured on day 4 prior to collection.
Now, is a person in the hospital for this?
Not for this. It's usually done outpatient.
When they come to have the stem cells taken from their body, is that sort of like making a blood donation?
It's different than a blood donation. They come in, they get a larger catheter put in, and they get hooked up to a pheresis machine, which only keeps the stem cells, and the other components of the blood get returned to the patient. The session takes about 4 to 5 hours, and sometimes they have to come back a second day if they don't collect enough stem cells the first day.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with nurse practitioner Linda Dinu from the Upstate Cancer Center. Where are the stem cells stored? Because they're frozen after they're collected, right?
Correct. The stem cells are frozen and stored at the stem cell lab at Upstate. They're frozen in less than minus 150 degrees Celsius. So the stem cells are preserved with DMSO, which is 10% dimethyl sulfur oxide. And they're preserved with this because it helps to reduce ice crystal formation in the cells and protect the cell membranes when they're frozen.
So once the patient has donated enough of these stem cells, then they concentrate on the chemo or the radiation or their treatment that they're going to have done, right?
Correct.
How long does that take then?
Conditioning is the chemotherapy given prior to transplant. So depending on the type of cancer they have, some start on day -2 or day -6. If they have multiple myeloma, they would start on day -2. If they have diffuse large B-cell lymphoma, they would start on day -6.
And how soon after the treatment is done do they receive the stem cell?
I'll do the day -2. The patient would come in the hospital day -2. They would receive their chemotherapy. Then day -1 would be a day of rest. And then day 0 is when the stem cells get reinfused.
Can patients feel the infusion? Do they feel a difference as they're receiving the stem cells back?
They don't really feel the infusion going in, but they can, like when the stem cells are reinfusing, because they're preserved with the DMSO, they can feel like some flushing, they can have some nausea, abdominal cramps, low blood pressure, their heart rate might go down a little bit.
So this is why they're in the hospital, it sounds like. There's some things to look out for.
Yeah, like when the stem cells are being reinfused, they're hooked up to the heart monitor, their oxygen is monitored, their blood pressure is monitored throughout the infusion.
How long does that infusion take?
It depends, because they'll get a special IV catheter put in, and the stem cells get hung, kind of like a bag of blood, and they go via gravity. So sometimes it can take between 10 and 20 minutes for one bag to go in. And every patient is different. Some patients will have only one stem cell bag. Some might have 2, some might have 3, and some might even have more than that. It depends on how many cells they collect and how they split the cells.
Typically, how long are people monitored in the hospital before they're sent home?
They're usually in the hospital for about 2 weeks after the transplant. Their blood counts are checked every day. They might need blood and platelet transfusions because initially their counts are normal. And then once they get the conditioning therapy, their counts go down and they stay down for several days. And then eventually the counts will start to recover.
Is there anything about stem cell transplants that people tend to misunderstand that you'd like to set the record straight on?
Depending on the type of cancer, they may have to continue treatments afterwards. They're considered immunocompromised for up to a year after transplant. And the whole point of the transplant is to give very high dose of chemotherapy and then rescue them with the stem cell reinfusion.
Have you seen stem cell transplants be life-saving?
Yes, they're life-saving.
How soon do you know whether it was a success? Does it take a whole year of recovery?
Well, when their counts start recovering, when their absolute neutrophil count is greater than 500, the platelet count is greater than 20. I mean, that's still not normal. But then when the counts start improving, they get discharged and then they have close follow-up at the cancer center.
Do you have any advice for family and friends, what they can do to help a loved one who will be having an autologous stem cell transplant?
Yes, they can support them. They could offer encouragement, visit them in the hospital, and help them at home when they're discharged.
Well, thank you so much. I appreciate you making time for this interview, Ms. Dinu.
Thank you.
My guest has been nurse practitioner Linda Dinu from the Upstate Cancer Center. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.